Most people think aging well means looking younger than your years. They measure it in skin, in energy, in the absence of gray hair. But after 30 years of practicing medicine, I can tell you that is the wrong measure entirely. After 60, one of the most honest signals of how your body is holding up is not what you have. It is what you have managed to avoid. I am Dr. Hiroshi Nakamura, and in my years working with older adults across a wide range of conditions, I have observed something that does not get said often enough. The absence of certain health problems after 60 is not luck, it is evidence. It is your heart, your kidneys, your nervous system, your blood vessels, and your metabolism quietly telling you that they are still functioning at a level that many people your age have already lost. Today, I want to walk you through 7 of those conditions, not to frighten you and not to make any promises, but because understanding what good aging actually looks like from the inside is far more useful than any mirror. The first sign is having no high blood pressure. High blood pressure is so common after 60 that many people have started to treat it as a normal part of aging. It is not. It becomes more frequent with age, yes, but it is not inevitable, and its absence tells you something meaningful. When blood pressure rises and stays elevated, it usually reflects a combination of factors working against each other. Blood vessel walls stiffen with age when they are not maintained well. The kidneys, which play a large role in regulating fluid volume and blood pressure, begin to lose efficiency. Sleep quality declines, which places pressure on the cardiovascular system overnight. Metabolic processes that regulate sodium balance and arterial tone begin to drift. When you do not have high blood pressure at 60 or beyond, it suggests that several of those systems are still communicating properly. Your vessels retain enough flexibility. Your kidneys are still handling their workload. Your heart is not fighting against elevated resistance with every beat. Think of it this way. A healthy blood vessel is like a garden hose that bends easily without kinking. A stiffened vessel is like a pipe made of old plastic. It cannot absorb the pressure of flow. Every heartbeat pushes harder against the wall, and over years, that pressure damages the lining of arteries throughout the body, including those supplying the brain, the heart, and the kidneys. If your blood pressure has remained in a normal range without medication, that is not a small thing. That is evidence of a better maintained system. The second sign is having no type 2 diabetes or uncontrolled blood sugar. After 60, stable blood sugar is one of the clearest signs of metabolic health. And yet, uncontrolled blood sugar has become so prevalent in this age group that many people do not even know they have a problem until the damage has already progressed. Here's what most people do not fully understand. Blood sugar does not have to be diabetic range to cause harm. Even chronically elevated levels that stay just below the diagnostic threshold can gradually damage the small blood vessels that supply the nerves, the eyes, the kidneys, and the heart. This process is slow, quiet, and largely painless until it is not. If you are over 60 and your blood sugar remains stable, your body is still responding to insulin appropriately. Your pancreas is not overworked, your cells are still accepting glucose the way they should. That is a sign of better metabolic function, lower inflammation, and a substantially reduced risk for the cascade of complications that follows when blood sugar control is lost. I want to be honest with you here. This next part is important. Stable blood sugar after 60 does not happen by accident in most people. It reflects years of dietary choices, movement habits, and sleep quality. If you have it, you have likely been doing something right, even if you were not fully aware of it. The third sign is having no frequent falls or serious balance problems. Falls are the leading cause of fatal injury in adults over 65. Not heart attacks, not cancer, falls. And they do not come from nowhere. The ability to stay upright, steady and coordinated draws on an extraordinary number of systems working together. Your leg muscles must be strong enough to absorb an unexpected shift in weight. Your inner ear must send accurate signals about your orientation in space. Your eyes must detect changes in your environment quickly. Your reaction time must be fast enough to respond before the fall completes itself. And your nervous system must coordinate all of these systems in fractions of a second, continuously, without you ever thinking about it. When those systems are intact, you move without thinking about moving. When any one of them begins to slip, the whole chain becomes unreliable. If you are over 60 and you move without significant fear of falling, if stairs do not require you to stop and plan, if uneven pavement does not feel like a hazard, your muscles, your vision, your nervous system, and your coordination are still working in reasonable concert with each other. That is a meaningful sign of how much physiological reserve you still carry. Stay with me for a moment. because what comes next is something I see very often in my practice. The fourth sign is having no major memory decline that affects your daily life. I want to be precise about this because there is a great deal of fear around memory and aging that is not always warranted. Forgetting where you placed your keys is not the same as forgetting that you own keys. Occasionally losing a name in conversation is not the same as losing the ability to conduct a conversation. These are different phenomena, and the distinction matters. What I am talking about here is the kind of memory that governs your ability to move through daily life with independence. Remembering your medications and when to take them, keeping appointments without constant reminders, recognizing the familiar faces and routines that make up your world, managing finances, following a conversation, navigating a route you have taken many times. If these capacities remain intact, your hippocampus and prefrontal cortex are still doing meaningful work. The connections between neurons that store and retrieve this kind of information are still functioning at a level that protects your independence. That is not something to take lightly. If this sounds familiar to you, if you recognize that you are still moving through daily life with your memory working as it should, write yes in the comments. I read them, and I want to know how many of you are experiencing this. The fifth sign is having no chronic shortness of breath during normal daily activities. This one is often overlooked because shortness of breath can arrive so gradually that people stop noticing it. They slow down their pace, they avoid the stairs. They stop carrying the groceries all the way to the kitchen. They adapt around the limitation without recognizing that the limitation has appeared at all. If you can walk at a reasonable pace, climb one flight of stairs without stopping to recover, and complete ordinary errands without feeling that your breath cannot keep up, that tells me something about your heart, your lungs, and your circulation that a machine cannot always capture as clearly. Chronic breathlessness during ordinary activity often reflects reduced cardiac output, meaning the heart is not pushing blood forward with the efficiency it once had. It can reflect reduced lung capacity, stiffened airways, or impaired gas exchange. It can reflect poor peripheral circulation that leaves the muscles starved for oxygen before they have done very much work. The absence of these limitations is a quiet form of resilience. Your heart is still meeting demand, your lungs are still exchanging oxygen and carbon dioxide efficiently. The vessels carrying blood to your muscles are still delivering what those muscles need. Most people miss this completely. They focus on dramatic symptoms. But the ability to breathe freely through the ordinary demands of a day is one of the most honest indicators of cardiovascular and pulmonary health that exists. The sixth sign is having no kidney disease or persistent swelling in the legs. The kidneys are among the most quietly important organs in the body, and they are among the most quietly damaged by the conditions I have already described. High blood pressure injures them. Uncontrolled blood sugar injures them. Certain medications taken over long periods can injure them. And because the kidneys do not announce their distress with pain until the situation is serious, most people do not know there is a problem until a great deal of function has already been lost. Your kidneys filter the entire volume of your blood many times each day. They regulate blood pressure through fluid balance. They help maintain the chemical environment that allows your muscles and nerves to function. They produce a hormone that signals the bone marrow to make red blood cells. When kidney function declines significantly, anemia often follows. Fluid accumulates in the legs and ankles. Blood pressure becomes harder to control. Toxins that should be cleared begin to circulate. I remember a patient named Keiko, 71 years old, a retired school teacher, precise in her habits and genuinely diligent about her health. She came to see me not because she felt unwell, but because her daughter noticed swelling around her ankles in the evenings. Keiko had attributed it to being on her feet. She had no pain, no unusual fatigue, nothing that would have sent her to a doctor on its own. Her kidney function had been quietly declining for years. Driven by mildly elevated blood pressure, she had not aggressively managed. She had not fallen through the floor. But she had lost ground that could not be fully recovered. If you do not have persistent swelling in your lower legs, if your blood pressure remains manageable, if your kidney function tests come back within normal range, your kidneys are still doing their job. That is a sign that multiple systems upstream are working well enough not to have damaged them. The seventh sign is having no severe muscle loss or frailty. After 60, the body begins to lose muscle mass at a rate that most people do not feel until the consequences are already present. This process has a clinical name. It is called sarcopenia, and it is one of the most significant contributors to loss of independence in older age. Muscle does more than move you. It stabilizes every joint in your body. It regulates your blood sugar by absorbing glucose during activity. It supports your posture, which affects your breathing, your balance, and your spinal health. It determines how quickly you recover from illness, surgery, or injury. And it is the primary physiological reserve that separates someone who is aging independently from someone who is not. I want you to pay attention here. The test is not complicated. Can you rise from a chair without using your arms? Can you carry a bag of groceries from the car to the kitchen? Can you walk for 15 or 20 minutes at a reasonable pace without your legs giving you serious difficulty? Can you recover from a normal day of physical activity within a reasonable time? If the answer to these questions is yes, your muscle reserve is still protecting you. You are not frail. Your body still has the structural capacity to maintain your independence, to absorb the physical demands of daily life, and to recover from the ordinary challenges that aging brings. This does not mean there is no work to do, but it means you are starting from a position of real strength. The body has a remarkable ability to respond when you give it the right conditions, even at 60, 70, and beyond. The goal of this conversation has never been to frighten you. The goal is awareness, and something more important than awareness. It is the recognition that what you have protected so far is worth continuing to protect. If you are over 60 and you do not have high blood pressure, if your blood sugar is stable, if you walk without fear of falling, if your memory still governs your daily life, if you breathe freely through ordinary effort, if your kidneys are functioning and your legs carry you without frailty, you are not just lucky. You are the result of years of accumulated choices, and your body is telling you something honest and valuable about how those choices have landed. Keep going in the direction you are already moving. Small, consistent habits, adequate movement, attention to sleep, reducing unnecessary stress on the organs that have served you quietly and well. These are not dramatic interventions. They are what preservation looks like in practice. If something on this list made you stop and think, if one of these areas is not as strong as it once was, that is also useful information. It is not a verdict, it is a direction. And the earlier you move in that direction, the more of what you have worked to protect you will be able to keep. If this was useful to you, subscribe to this channel. I will continue sharing what I observe in my patients so you can make better decisions earlier, and leave a comment below. Tell me which of these 7 signs you feel most confident about. I would like to know where you stand.